It's loading. All right, we're live on Facebook. Can you hear me okay, Kev? All right, awesome. Thank you guys for joining us today. We are having another Kerri's Corner event. We are with Kevin Cho Tipton, one of my really great friends, a critical care nurse right here in the public health system here in South Florida. Before we get started, I just wanted to kind of name, so my name is Kerri-Ann. I'm a candidate for City Commission here in Miramar, Florida. I'm a third generation Miramarian, and so the future, sustainability and growth of the city of Miramar is near and dear to my heart. And one of the main reasons why I am actually, it looks like our panelists cannot get off mute. Are you able to get off mute now, Kev?
Yeah.
Okay, awesome. One of the main reasons why I'm excited to have Kevin with us today to discuss battling COVID-19 is because, like many of you, the pandemic has been top of mind since March. I think none of us would have imagined 6 months ago that we'd be here still battling a pandemic and concerned not just about the health of our community, but also the economic impact and the extreme disparities that have been brought to the surface due to the pandemic. And so I'll just start off really quickly with some current numbers. Miramar, Florida, as you all know, is located in Broward County. And as of earlier today, we have had 75,944 cases of COVID-19 throughout the county. And of those cases, we've had just shy of 1,400 deaths reported directly from COVID-19. And when we actually zoom in just a little bit more specifically to our community, the city of Miramar, as of last week, we have 4,798 cases. And over the past month, we've had an increase of just under 20 new cases a day. And so with that being said, I think the other thing that I would love to name is that my mother, she actually works in the public hospital here in Miramar. And so this is really near and dear to my heart, from being concerned with her access to PPE, making sure that she has the supports, not just physically, mentally, socially, going in and battling COVID-19 and all the other things that shows up in a public hospital setting, but also the concern of like our family, our friends who she interacts with day to day. And Kev is nodding his head because it's the very same thing that's top of mind for him. So with that being said, I'd love to kind of pass the mic to Kev. I'd love to have you introduce yourself. And one of the things you can start off with is, what made you get into the medical field? And tell us a little bit about your background before we begin.
Thanks, Kerri-Ann. It's great to be with you. I met Kerri-Ann back in college, and we've been friends ever since. I started off working in healthcare policy and then quickly realized that clinical work was more important to me. So about 10 years ago, I became a nurse's aide, worked my way up through the public colleges, and went to grad school, became a nurse practitioner. Been doing this for about 5 years in the military and then the public hospitals here in South Florida.
Awesome. Thank you, Kev. And what motivates you to keep going day to day? As a critical care nurse, I know you're on the front lines, you're seeing cases related to COVID-19 and otherwise, but what are some of the things that keep you motivated to wake up each day and continue the fight?
Well, actually, one of our mutual friends, Chris, who we went to college with this year, and his dad was sick in Orlando for several weeks with COVID-19, ended up going to the hospital. And as I've told him, it's really meaningful for us to see people come home and get better, rejoin their families. He has 2 young kids and 2 older kids our age. But those small victories mean so much to us because ultimately we know everyone we take care of has a family at home, has someone that loves them. So for all the people that don't make it in their ICU, it's important for us to celebrate those who do, and that's what keeps us going. And that's, I think, common throughout all ICUs, not just mine, but the ones across the country, especially here, where we've been so hardest hit here in Florida.
Absolutely. And I'm so thankful that you're able to join us, Mr. Scott, and for your recovery. The last question, Kev, that I wanted to just kind of pose to you. So I shared some of the numbers right at the beginning of this and some of like why it's personal for me. But from your perspective, I'd love to hear what are some of the biggest challenges related to battling this virus and really nipping the pandemic in the bud?
I think some of the biggest challenges is a lot of inconsistency between levels of leadership on some things as simple as mask use. One thing I appreciate you've been talking about very much about is mental health as well. This the stress put on families that feel so alone, sequestered in a house, watching their family members on essentially uh, um, applications like Zoom, like this, to see their loved ones in a hospital dying of COVID-19 has been traumatizing for them. But at the same time, we used to call families and tell them how they're doing and have them visit their loved ones in the hospital. But now we're being let into their living rooms, let into their very family-oriented spaces, and it's become a very intimate, very emotionally draining experience, not only for the families but for us all across the country, not just here in Miramar, but in every ICU, talking to these families, saying how much we're trying, but we don't know if it's going to help. Um, those have been the biggest challenges: staying mentally, emotionally, and even physically resilient. For the bedside caregivers like respiratory therapists and nurses aides like your mom, who have to wear PPE for sometimes 5, 6, 12 hours at a time, especially if there's an emergency, is physically draining. Firefighters, will be in all this protective gear, and they'll take it off, and and after being in a fire, um, there's similar aspects of this as we are in complete gear, sweating in plastic water proof, um, essentially sheets. And for these bedside providers, it's very challenging for them physically. So that on top of the mental and emotional stress, it's been difficult. But people are resilient, and we're focusing on people like Mr. Scott who made it home, and we're hoping for more miracles like him.
Yeah, for sure. And I know recently, I think you and I were supposed to chat, and then at the last minute, you had to change the date and time, and you were like, I've got to go in. Like, I wasn't scheduled to work tonight, but we just need all hands on deck. And how do you balance the need for a break, especially given what you just mentioned, like you're in the gear for sometimes 12 plus hours, plus the mental drain and like, I can just imagine the feeling of like, am I doing enough? When we know that our frontline workers are doing more than enough and consistently need to just suit up and go back out there, right? How do you deal with like the social impact, the mental that you mentioned just a while ago? Like, what are some of the things you're doing to cope?
I've been trying to invest in a lot of things that I think helpful outside the bedside. Talking to people like you that get it, and from college, I always knew how much you cared about these issues about people, and just knowing that there are people that are out there that don't necessarily work in medicine, but get the challenges, the very personal challenges that these crises cause on families and on people. It makes me feel better, because when I look outside, sometimes I see people not wearing masks, but then I go talk to people like you, and realize, oh, people get it. And maybe it's because your mom imparted that on you, because we work at the same hospital. Um, anyway, yeah, that's what helps me.
Yeah. I mean, I would love to think even if my mom wasn't in the healthcare system, I'd still care enough to want to wear my mask consistently. I think everyone's been in that situation where you're in your car, you're like, all right, I'm going to run into the store, I'm going to get these two things, and I'm going to go home, I'm going to do this. And you're so caught up in like the steps and the logistics of it all. You get to the door and you're like, oh, my mask. And so you've got to run back to the car. And so I think what I have enjoyed thoroughly seeing throughout not just my neighborhood, but the broader Miramar community and Broward County is the community's commitment to honoring frontline workers and respecting the work that you all do every single day by simply wearing a mask and committing to it. And I have felt pretty proud to be in not just a city, but a county that very early on mandated wearing a mask out in public, even if you're at the local park walking or jogging, like having on a mask. And so I think those small things make such a big difference as well.
I agree.
Yeah. So, I mean, Kev, I'll hand it over to you. I'd love for you to just share. I mean, I mentioned some of those statistics early on with the number of cases in the county. Like I had said, just under 76,000 cases in Broward County, and just under 5,000 right here in Miramar. And throughout the county, about 1,350 deaths so far. Hoping that we don't see that number trickle up anytime soon, especially as kids K through 12 are about to go back to school, not just here in Broward County in the next couple of weeks, but they've already gone back to school in Palm Beach and they will soon in Miami-Dade. But from your perspective, what are some of those statistics or data points, whether they are qualitative, quantitative, anecdotal, that we should be privy to and keep top of mind as we go about our day-to-day lives and enter into flu season, which is inevitably coming up?
That's a good point about flu season. Number one, I would say I encourage everyone to please get your flu vaccine if you're able to. It's something that can help protect you from getting sick. And remember, if your immune system is already depressed from, say, like the flu or something else, you're also more at risk for other infections. So number one. Number two, I would say now that the data has matured, I think we can all, Kerri-Ann, we were discussing this. It was difficult to determine how many people were actually positive in Broward County because of how the data always seemed to change. My suspicion now is that the data has matured. How they process the data has matured. It's more uniform. The state and local governments have been more on the same page. That being said, we've rapidly seen amount of diagnoses drop and per day over the last few weeks, which I'm very thankful for, because at one point, and I don't want to sound overly urgent, but the public hospitals here in South Florida, in both Broward and Miami-Dade, had to bring in hundreds of staff from around the country. And I got to meet many of these people. They were nurses and doctors and respiratory therapists from New York, from Detroit, from New Orleans, some of which are still here in Miramar, who have literally gone from hotspot to hotspot to hotspot. And it was kind of telling for me, like, really, wow, we have now these people that were in New York where we all saw it was so bad, and they're here helping in South Florida. This was a tell sign that we needed to take it seriously. So what can we look at data point wise? I think the best thing we can look at is hospitalization numbers. Those, along with cases diagnosed, have been rapidly decreasing. Now, our ICUs are still very full in many cases. The public hospitals are between 80 and 180% capacity in the ICUs because of COVID patients, plus people who are suffering from regular non-COVID health challenges. These people who have a car accident and have a trauma, people who have a heart attack, a stroke. These are things that are everyday catastrophes for families, and they're also facing these on top of facing COVID. So not only are families facing this, they're facing what we're used to facing in ICUs. So the ICUs are full, very full, specifically because people are sick as they usually would be, unfortunately, and dealing with COVID. And some have both, and that makes it even more complex. So I would say track hospitalization numbers and watch what is publicly available from the public hospital systems, Broward Health, Memorial Healthcare System in Jackson. All three of these, especially Memorial, which exists inside Miramar's zip codes, but also Broward Health and Jackson, because the city shares borders with all of these communities that are served by these hospital systems. And they have publicly available data showing that hospitalization numbers are down. And I think these are important numbers to follow.
Yeah. So when you say hospitalization numbers are down, is that a sign to say this pandemic is almost over, we can start to like ease up on the restrictions? Because I've also been hearing that a lot, is like, I'm not even hearing much about it anymore. I've gone to a wedding, and not me personally. These are things I've heard people say. Like I've gone to a wedding and I came back and nobody's reporting that I'm sick. So I think we're good. We're done with this pandemic. Is that a realistic or right mindset to have?
Uh, I should be very clear that my opinions here are not to supplant anything that my hospital system or where I teach or for that matter where I serve not any official positions. My personal opinion is to gather data from the CDC. Even though I get it, the CDC has been kind of difficult to determine exactly how to present data. But I will put it this way, in a very less data-driven but anecdotal way. Last week, we admitted an entire family, a mom and a dad and a grandma, to our hospital system, who all suffered from COVID. Unfortunately, one of them passed away, and the only family member that is not in the hospital right now is a young adult child that now has to make decisions for their entire family, which to me, I can't imagine the strain. But I would say that whether we think it's over or not, families are still getting sick together and coming into to the hospitals, and ultimately many of them to the ICUs, and some of them are dying. So I say to especially the college age kids, high schoolers who are really wanting to get out there because their risk is so low. Just remember, you guys have parents in their 40s, 50s, and 60s. You have grandparents even older. For Kerri-Ann and I, our risk of having, of dying from COVID-19 is less than 0.2%. But for our grandparents that reach age 70 and 80, it's reaching 10 to 15%. And, yeah, a lot of that means the vast majority of people are not going to have symptoms or even be sick. But, I would just say, if you get the sniffles and you think it's nothing but end up being COVID and you give it to your grandparent, can you live with yourself if you give it to them and something happens to them? I think that's how we have to think of this, is very human terms, not like the pandemic and system wide and all these things, but can you live with it?
Yeah, that's a really well-spoken and thoughtful way to put it, Kev. I think it's the same thing we've been hearing, right? Like, we're in this together. We have to unite as one to truly recover. And I think the other thing too is that, like, there's other countries, right, globally, who figured this out,
Yeah.
who've nipped it in the bud, and like they're back to normal. They're having socially distanced concerts, and schools are open and have been open. And so it's really important for us to understand that with a community mindset, with a, kind of the Sankofa thing that we learned at Black Student Union at FAU, right? Like, each one teach one, go back and bring someone once you've learned. It's that mindset of, I'm not doing this just for me. I'm doing it for my grandparents, for my mother, for my friends who might have a pre-existing condition, right? Like, that's another thing you hear teachers are saying, okay, great. Like, you have a plan to go back to school, but what's the plan for me as a teacher with a pre-existing condition, right? And so regardless of the age, just keeping in mind that there are disabilities that are not, you can't physically see them, and you need to be aware of that so that you can move accordingly to keep everyone safe.
Absolutely, and I think that you mentioned the good thing about the teachers being exposed. Not only teachers are getting exposed, but it's not just about age. Yes, age is a big factor in dying, but also there's a lot of evidence suggesting that people who are overweight, especially those who are severely obese, we're talking about 300 or 400 pounds, or diabetic, these people, regardless of age, are extremely high risk of dying of COVID-19. And if they don't pass away from COVID-19, which is unfortunately happening to between 60 and 80% of everyone who comes into an ICU, which is a huge number. I mean, that's if I get 10 patients, I have to expect that between 6 and 8 of them are going to pass away regardless of age. And that's hard on families, but also hard on staff. But mostly, if they do make it home, these people are dealing with long-term disabilities. And I think what we're going to start seeing now is not just a focus on wow, a lot of people have passed away. 200,000 people have passed away. 13,000 right here in Florida. Um, we're going to talk about people who are going home and dealing with these challenges that are very personal to them, dealing with the stress of now being like, wow, I have to now take care of myself in a different way. People that go to the hospital healthy and come home with multiple medications, this is a challenge. And not only for the patients, but for their families to adjust, and to take, and kids are becoming their parents' caregivers at very young ages now, and dealing with that strain mentally and emotionally,
Yeah.
take it out in ways that aren't always healthy, might not always help them, even though they didn't think it makes them feel better. So like people will like not take their medication, or they'll turn to vices that don't help them, just out of desperation to feel a sense of normalcy. And I think this is what we're going to start seeing. And I hope that um, that leaders at all levels and the media start talking about not only the deaths, but the disability.
Yeah. Yeah, for sure. I think we're just at the very initial stages. This is going to be in history books from the quarantine effects on student achievement rates and results, given that they've had to pivot and go virtual, to the economy, to the preparedness of our healthcare systems, our emergency management systems at municipal, statewide, and federal levels. And so whether or not someone wants to think the pandemic is over or go back to things as they were, go back to normal. I've heard a lot. The new normal is just going to be that, right? It's going to be new. I don't think, at least for me personally, that I would give up wearing face masks in public anytime soon. Especially, I'd love to hear your thought on this, Kev, if you've seen it recently. I want to say like Sunday or Monday, so that would be yesterday. There was a report that came out that said that COVID-19 is and has been airborne beyond 6 feet. But then literally hours later, news came out that the CDC said it was an error. It was like a draft message. Sorry for the false alarm. And so my question is it a false alarm because you released it too soon and you forgot to like go through and dot your I's and cross your T's, make sure the grammar is right? Or was it a false alarm in that this was a theory that accidentally got through into the final draft? I'd love to hear your thoughts on that.
We've been monitoring this as healthcare and healthcare, and I don't work in primary care where the vast majority, we're talking about more than 80% of everyone that gets COVID-19 is never going to need to be in a hospital. We're talking vast majority. So I don't want to overstate what's happening, but I will say from my experience, because I see the sickest of the sickest of the sick on life support, we take it very seriously, and the potential for airborne spread is there. So I think that if the CDC has proven anything, it's that we are still in an evolving time where we don't fully understand this virus. I think there has been data to suggest that it is airborne. It can be airborne in some circumstances, but at the very least, I would say the CDC has made it difficult to sometimes interpret the data because of questions of politicization, and also because of questions of universal accuracy. At first, they said don't wear masks, and in retrospect, they're saying that was because there wasn't enough for healthcare providers. So I think that we owe it to ourselves to be very vigilant, very very intentional about how we interpret this, but also to talk to your trusted healthcare provider, whether that's a doctor or a physician assistant, a nurse practitioner, someone that your family trusts. I would trust them to give you the best advice, because in ICU, I'm very focused on getting people well and out of the ICU. For those primary care doctors and providers out there, they're very focused on keeping you out of the hospital. So I would trust them most with
Yeah.
with that question, and I think the families should too.
Awesome. Thank you, Kev. That's very helpful. All right, so Q&A. I would love to just hear from your perspective, being in the hospital setting. When you think about your peers coming in day to day, what would you say some of their fear, and this includes you, right? What are some of your fears going into work, leaving work day to day?
I'm very afraid that I'm going to bring it home And you know, I've been very selective about who I've seen. I remember I stopped by your house to drop something off, and I remember I basically ran into your garage. We were 15 feet apart, and then I left. Um, I um, and I think your mom, I'm sure your mom feels the same way, because even though not all healthcare workers take care of COVID patients directly, some of us take care of them and don't know. And for instance, one of my coworkers lost her husband, who was a psychiatric nurse, not taking care of intentionally a COVID patient, but I know did get exposed. Um, uh, I think my biggest fear is that I'm going to bring it to someone, I'm going to be fine, but they're not going to be fine. And after seeing that people my age can pass away from this, even though it's rare, what if someone's 0.1% that I run onto when I'm going grocery shopping? Because, you know, my mask, and I think everyone should remember this, when you wear a mask, you're protecting other people from you, mostly. There is some limited protection you're getting by wearing a mask yourself, but when you are wearing this mask, you're keeping those droplets, your breath, from spewing out. If you ever sneeze on you know in your on your arm, and you feel all that stuff that comes out of your mouth and your nose, those masks are intended to keep everything that you just felt that would have gone into your arm inside the mask, then from spreading everywhere. And so my fear is that I think I would get someone else sick, and I think that's my biggest fear.
Yeah. Are there supports in your work setting for dealing with that? I know you just mentioned your coworker lost her husband.
Yeah.
What type of support, whether it's formally through the employer or just coming together as a community, like what have been some of those things you all have done?
Luckily, the public hospitals have been very good at offering mental health care to their staff. And I will say, I would expand this to say, it's not just me in the hospital. We have truck drivers that come to deliver food to every hospital. You know, there are I mean, everything touches healthcare. Just like your work in education, everything touches education. If a parent's not healthy, they can't get their kid, get their kid to school. That affects their education. All of these things are interconnected. I think education and healthcare are two of the most wide-ranging fields. And so, not just me getting the mental health care, which is one reason I appreciated your last Kerri's Corner. But all these people getting healthcare is something that the public hospitals have been trying to do, even offering free services to the community at large that needed it. And I think that's been very helpful.
Yeah, absolutely. I think even small things that civilians, non-frontline workers can do, like we did pizza delivery, which was something that
Yeah.
was really awesome, and it was so great, even though I myself couldn't come into the hospital, but to actually see folks enjoying the pizza and it bringing a smile to their face. And so I think just remembering those small gestures, right, those acts of kindness to let folks know, like, have a small break from your mental focus on serving, protecting, and healing, to let the community members be able to present, this is why we cherish you, and you truly are our heroes, right? Without you, we would probably be back at square one, right? The commitment that you and other frontline workers are doing each day.
Yeah, and I will say that pizza that you got, the desserts, by the way, got eaten by one of the environmental staff. So and I know that nurses and doctors get all this heralded praise, but I mean, it's you were able to feed you know, 3 environmental workers that literally, after the nurses and doctors lose a patient, they go in there and they spend 20, 30 minutes cleaning those rooms. I mean, we could not do the job without all these people that are doing it. And, you know, I think respiratory therapists, pharmacists, who also got some pizza, by the way, the
Yeah.
environmental staff, the security guards, all of these people make it work. And these paramedics and firefighters and even police officers that have brought people. There was a police officer that was, I think it was a Miramar police officer that helped someone into the hospital because she couldn't get in from her car. This police officer had no PPE. She was I think she was young. Um, uh, she just wanted to help, and you know, these random acts of very human kindness are meaningful, but we also realize that all these people are in danger too.
Yeah.
So it's meaningful, those gestures.
For sure. Okay. Any questions you have for me, Kev? I feel like it's just been one-sided. Like, tell me this.
Oh, I'm curious because you were talking to me about something that you had plans to do for the city, and I was curious about what you thought about the policies that were in place and what you can do to make things better for
Yeah.
Miramar.
I mean, I think so. One of the first things that I'll name is that I think the city's initial response to the coronavirus pandemic was extremely strong. And I was a proud resident and was sharing everything. And I mean, I still do. There's still amazing things that are happening citywide to address the pandemic and the longer term effects of it. I think one of the biggest things that I'll tout as a Miramarian is the coronavirus relief fund that the city of Miramar actually put into place in April. So very early on when the pandemic started to hit and we began quarantining. And that really provided rental, utility assistance and support to families most in need throughout our community. And unfortunately, though, that assistance program stopped, I want to say maybe in early August was when the last few applications came in. And for me, one of the largest things is you still are hearing about the long-term effects in our county, right? And I think really in all of South Florida, some stores, some businesses still aren't able to open, like bars, for example. And so if you think about the economy and the people who work in those settings, they're not working. They haven't been working since we've kind of shut our state down or our community down to avoid the spread of the virus. And so I think as a major city in Florida, we're the third largest city in Broward County. So if you take that into consideration, Broward County is one of the largest counties in the United States, period. And we're the third largest city in the county. Making sure that we are strategically using our resources to help neighbors through local economic initiatives. And so one of the things that immediately comes to mind, increasing the income threshold for you to qualify for those resources and assistance programs. So really making sure that we're on par with statewide programs like the Medicaid expansion that recently took place. I think, not to get too crazy in numbers, but the highest number in the city of Miramar was 120% to poverty line. Expanding that to match Medicaid to be just that. I think it's not exactly 140. Correct me if I'm wrong, Kev. I think it's like 139 point something.
Yeah.
But expanding that,
Yeah.
it might seem like an expansion from 120 to 140% is very minuscule, but you're talking about a 20% increase in the qualifying parameters. And oftentimes, those are the very people who are on the cusp that need that expanded support and access in a way that they've historically been left out. Even when you go back to the stimulus check that came from our federal government, in many ways, people were right on the cusp for that support. And so really utilizing the data that we have to inform the average household income in Miramar, the average number of people living in a home in Miramar, to ensure that those who are in need, whether it is through utilities, rents, or any other supports financially, we're actually sharing that the resources available, which is something I often hear speaking to residents. I had no idea that that even existed. How would I figure this out? And then two, making sure that we're expanding the amount of people who can benefit. And so that would be the first thing that I would do if elected, is reinstate that coronavirus relief fund, to make sure that we're prioritizing not just the physical and financial safety and security of our residents, but also the mental. Because if you're figuring out how you're going to make ends meet and you're not too sure, we heard a lot about the unemployment applications here in the state of Florida especially, and the delay that people are still facing to this day, not being able to access the system. So the mental health and security and safety, knowing that your basic needs, right, the shelter, food, and security are covered through reinstating that program. So that would be one of my first things that I focused on. And I think the other thing to highlight is that we've been doing phenomenal with weekly food distribution services throughout our community. I think the last time I saw, there was almost 2,000 people who drove up and received food, and that was just last week on Thursday, right? And so making sure that that continues. But I think one of the things that's most important is that when we are distributing food to residents, that the food is not expired, which is something that residents have also been complaining about. Is like, I'm so thankful, this is helping me make ends meet and carrying me through to the next week when distribution happens again. But there's also been a large amount of residents complaining that I get home, I open up what's been provided, and food is expired. And so making sure there are checks and balances in place to ensure that what's being provided is actually able to be used and eaten safely by people who receive it. Those are a couple things that are extremely top of mind as it relates to ongoing support for residents in our city.
No, I think it's meaningful, and your mom and I both serve the city and all the families that live in it and in the hospital system here, and I think it's it's personal for everyone here, because it ultimately this crisis is not one of numbers on a screen. It's one of people and families who are suffering not only through loss of loved ones but also loss of income. And
Yeah,
I think the relief fund is not only a great thing the city can do, but something that working families depend on. I think that's why it's so important. And
yeah, absolutely.
great.
Yeah, I know, Kev, you are, because you have a kind of a tri-county lens to this work, what are some things countywide, statewide that can also be done, kind of zooming out a little bit beyond the municipal level?
I think that a lot of what happens in Miramar and other cities around it are affected by, Broward County is a very thin county, north to south, and but it also borders Miami-Dade. A great number of the patients that we've been seeing in Miramar's hospitals are actually from Miami-Dade spilling over. So these families are also coming from Hialeah, from Miami Lakes, and that's an important concept to remember, because that means the partnerships that we have to have are also important between the counties. And I think that mask use is something that I'm glad that the Tri-County area did enforce. I would like to see the whole state do it.
Yeah.
Something as simple as that. A group of 500 healthcare workers here in South Florida sent a petition to the governor to get that done, which it didn't happen. I think I would like to see more uniform mask use, number one, by the state leadership. But where the state fails to lead, I think it's important for the local communities to lead, and that's why I'm so happy to be here to talk to you about these things, because what do they all say? All policies eventually affect people locally, and I think that's the most important place to start.
Yeah,
I think
absolutely.
no one else would do it, so why not?
Yeah. And I think that's the most important thing, right? Like, it starts with the people. And the other thing I have to mention is today is National Voter Registration Day. And I think the thing that you just mentioned is that it all starts locally. And oftentimes I think people flip it. They think it's from the top down. But the elections that I think, and I'm not saying this selfishly because I'm about to embark on a local election, but the elections I think that makes the most change in your day-to-day life, where you see the effects of legislation and budget decisions being put forward, are those local elections, those statewide elections. So your state reps, your state senators, and your local commissioners, countywide or city level. They're the ones that really impact your day-to-day, whether you're driving and there's a stop sign or there's a stoplight. Like, that decision is made right here locally, in addition to the federal elections, which we know is coming up in November. But I think making sure that you're registered to vote, your voter registration status, and you've told a friend and family member to do the same, so that you can have a voice in making sure that the decisions and policy that matter most to you are top of mind and being decided on by you and other people who you care about, who are directly going to be impacted.
Kerri-Ann, I will say this. I mean, I've known you for about a decade or more now. Obviously this is a video to support your candidacy, but the reason I wanted to do this video with you is because I know in your heart you truly care about the people that are around you, that have built you up, supported you, your mom. I mean, people from BSU back at FAU. you don't you're not transactional in how you interact with people. Your care is genuine, and that's why I'm so happy to talk to you about this and support you, because number one, I know that your heart is in the right place, and I know that and I know that you recognize the importance of how, something as simple as managing a city's trash pickup routes, or that stop sign, or getting that traffic light built with the county, that these are important things, that maybe they're not on the news every day, but when you are a good administrator of a city and make the decisions that are helping families, that's how you change lives, and that's how you build communities, and that's how you become that's how you become a good leader. And I'm here to help you, by talking about, how we can help, everyone with COVID-19, because I believe, so much that you're the person to do this, and that's why I'm so happy to help you with this.
Oh, thank you so much, Kev. I appreciate it. I think, yes, to everyone who's listening, like Kev and I go way back. We started off just in organizations and clubs at FAU, along with Chris, who's on the line too. But we definitely, I think, have watched each other grow, mature, and really lean into the very things we talked about: going to the cafeteria, going to class, like, I have a dream to do XYZ, and in 5 years, 10 years, I see myself doing it. And it just feels, I feel really blessed and thankful to be where I am today, and to have people who support my vision and support just growth, inclusion, transparency for our city, especially because we are so diverse, making sure that we set the foundation for that diversity to prosper in a very equitable and inclusive way, where everyone feels like they can thrive and live their best life safely, with the pandemic or not, and so I'm really thankful for your support. All right, we're at the time now where I would love to just open up the floor. I'll make it so that folks can come off of mute, to ask any questions, and then I'll also check to see if there are any questions from the Facebook Live. So if you have any questions, go ahead and unmute yourself and feel free to ask.
So how do you keep yourself motivated within this time, like with things being so distant, and just things being everything virtually? Like, how do you stay motivated and willing just to go through this process?
Um, that's a good question, Ashley. I just
Yeah.
try to stay positive. Obviously, more tears have been shed this year than I think, ever, in most of these hospitals. But, look at Kerri-Ann, investing in the people who are able to get home back with their families, and remembering that there's so many that are getting back home, is what keeps most of us afloat emotionally. And that's been hard, but it's been meaningful.
Right. So do you ever feel selfish to ever take self-care for yourself, with so many people um having this virus, and so many people just depending on you and so many other nurses? Do you ever feel selfish to be I can never miss a day at work. My time doesn't really matter, because it's I have to worry about these people that have their health on the line.
I think that's a natural feeling for any of us that are gifted with health right now. I think with 13,000 Floridians that have died, there was a point when every 6 to 10 minutes a day, a family was getting called that their loved one had passed away in our state, just in our state. And so, I think just recognizing how privileged we are to have our ability to talk, walk, and be healthy has made me feel a little selfish, because I see some people who don't have it, including many of my coworkers, some of which have died in their own hospitals. So selfish, yeah, it's a weird kind of selfish, but certainly I've felt that, and I think all of us have felt that, not just in medicine, but across the community.
Wow. I can definitely hear exactly what you're saying.
Thank you, Ashley. Anyone else on the line with any questions or just comments that you'd love to share? Okay, I'll take that as a no. All right, well then, Kev, let's share some resource. Oh, wait, we do have a question. It came through the chat. What are you most looking forward to? From Chris Scott.
um, what am I most looking forward to? Well, someone said once, I forget which philosopher it was. They said, in times of grief or stress, you need to have something to do, someone to love, and something to look forward to. I think that's good for anyone dealing with loss, grief, or even personal loss. Not even in the sense of like I've lost someone, but I've lost my independence. I've lost my sense of pride, or I've lost my job. What am I looking forward to? Honestly, like everyone else, I'm looking forward to an end of this where we can adjust to a new normal, where we can, go see our parents without being afraid of getting them sick. Go seeing our friends without having to, hide in houses. I'm looking forward to that because I think we are all alone together, but that will only get us so far. I'm looking forward to,
Yeah,
a new normal where we're normal again.
for sure. I think for me, it's the same thing. Looking forward to not thinking twice about accepting an invite to go to dinner or lunch or brunch, which I miss the most. And I think that lingering thought in the back of my head of like, am I doing everything that I should be to keep everyone I love and those that I just come into contact with when I'm walking my dog and I'm passing by someone? Am I doing everything that I can to uphold my end of the bargain of being a good community member, a good neighbor, a good daughter, a good sister, or just friend, right? And I think, granted, I have a new lens on life and just the level of thanks day to day for health. But once we get to a place where we know more about the longer term impacts, hopefully we have a vaccine that can allow us to have that sense of security as a community. I'm looking forward to that the most.
And I will say there is hope. Please don't lose hope. Anyone that has heard me speak about this crisis, because there's been new data showing that even after 4 months, if you don't feel better, your lungs are still have the great potential to help repair themselves. So people who have made it home, people like Chris's dad, I want to make sure that anyone that sees this that is recovering from the virus, don't lose hope. Remain hopeful about your prospects of recovery, and try to focus on investing in yourself, taking time, energy to take care of yourself and give yourself that time to recover.
Yeah. And I think, we've talked a lot about the ups and downs, the positive things that have been coming about as we come together as a community. And I think the other thing is to just continue monitoring the data locally that indicates that our positivity rates are going down. Although schools are opening, and I know that's top of mind for everyone, just continue to monitor those rates, because I think that's indicative of the work that we've been putting in as a community, working for the longer term.
I agree. That's good numbers to watch.
Awesome. So for resources, Kev, feel free to chime in and share anything. I'll also create a post so you all don't have to remember these exact links, but definitely miramarflorida.gov /coronavirus update. I'll put the exact link because there's a hyphen included, but there's where you can find the latest numbers right here in the city of Miramar. There's also resources where small businesses throughout the city of Miramar have access to free face masks to provide to customers and employees. And so there's a link on the website as well for that. And then the other thing is just testing, being sure that you are aware of the testing centers here in Miramar. The Vernon E. Hagerty Center in East Miramar is the #1 place where you can go to get tested. Make sure you have your ID. In the past, there was sometimes upwards of a 3-hour wait in order to get tested, but now the wait time is actually under 30 minutes. And so
in a day or two, so it's good.
Exactly. And so don't hesitate. If you've only got your lunch hour, for example, to go and get tested, you can actually go get tested in under 30 minutes in most cases. And there's testing there 7 days a week. So keep all of that in mind. Again, I will create a post with the links to these very things, especially for those free face masks for small businesses, which is another great offering the city has, so that we can all continue to have the resources to remain safe. Any other resources, Kev, that you would share?
I would say go to floridahealthcovid19.gov. It's a good state-run website that helps to give a one-stop shop for testing sites. For those of you that live in Broward County but outside Miramar, there's lots of testing sites in Broward County. And I think and those who live in Miami-Dade that just to join Miramar as well, there's many all over. So that's a good website to go to. And also I'll give you a link to statewide numbers for hospitalizations and things like that. That'll help you guide outside what's being reported, what's happening.
Awesome. All right. If there are no more questions, we'll go ahead and wrap up. Thank you all so much for coming. I think this is an important topic for us to continue keeping top of mind as a community. And I think a huge shout out again to my good friend and critical care nurse, Kev Tipton, for being here with us today and providing us with not just behind the scene tidbits, anecdotal information, but especially the data points that are so important for us to keep in mind. Thank you so much, Kev.
Well, my pleasure.
All right. Bye, everyone. Have a really good night and stay safe.